Yes, good reminder. Okay, so good morning and welcome, and thank you for being here. If you haven't already, if you could put in the chat box who you are and what you like to be called, that would be wonderful so you can see who's here. We're here today for our annual chance to review Franklin County's results in the Robert Wood Johnson National County Health Rankings. And to hear from our legislators about what legislation they recommend to address the problems the rankings highlight. So before we start, I want to draw your attention to the webpage on FRCOG.org for this event. So if you go to FRCOG.org, the very first thing that should be showing there is this event, and all kinds of reports and links that we're going to be talking about are there. So in particular, if you want to nerd out on the data and look at how we've done from 2016 to now on each of the rankings and what the rankings mean, that's all there, as well as links to the actual website of the Massachusetts report and other things. We don't have very long in this meeting, so we probably aren't going to be able to answer many questions, but I hope those handouts will, and I'm available anytime to answer your questions about the county health rankings or help you learn how to use them if you're interested in using them for anything. But just really trying to minimize the Zoom fatigue and keep the meeting relatively brief. So let's get started. First off, thanks to the sponsoring organizations of the CHIP. The Community Health Improvement Plan Network, which is what is hosting you here. And a special welcome to our newest leadership team members, GCC and CISA. And many thanks to Bay State Health and the Massachusetts Community Health and Healthy Aging Funds, which fund our cross-sectoral work together. So if you're new to the CHIP, please check out our website at frcog.org/CHIP to read more about the network and about the priorities that we're working on for the next 3 years. So to start, I want to ground us all in the model of health that has been guiding the work of both the CHIP team and the county health rankings for years. So this model shows the relationship between policy, health factors, and health outcomes, and it illustrates how those all work together. So starting down here in the blue part, policies and programs, we know from the research that effective policies and programs at the local, state, and federal level improve a whole lot of factors, which are these colorful things here, that in turn shape the health of communities. We often in our world call this working upstream from the problem. So as an example, the Fair Share Amendment is a state policy, one of those dark blue things. It's a change to our Constitution that will tax your second $1 million of income that will invest into health factors, the social environment and the physical environment, because it's earmarked for education and transportation. And that would lead to better income, better access to work and education, and finally, longer and better life. So this is actually the part of the model that we're focusing on this year by having our legislators here to talk to us about bills and policies that are important to actually improving health here. Okay. Next, so that's the model we work with. As all good students know, you should always report on the limitations of the data you're sharing. So here are the limitations of this data. First off, the county health rankings are based only on data they can get for every county in the country, right? So that limits the usefulness of some of it. So make sure you dig in if you're going to use it and understand what it's using, what it's actually using as the data source. Second, they're based on county geographies, so they don't include any data from our friends in the rest of the North Quabbin. And third, we don't have control over what or how they stratify data. So they only do it when they have enough cases, and they only use census definitions like white, Black, Hispanic, leaving little room for kind of intersectional analysis or questioning the constructs of race. And it's also important, finally, to notice that this model was designed to bring into focus the social determinants of health, but obviously there are some people for whom a particular one factor can be a very powerful determinant of their health. So this is really about us as a society. So that's a lot of limitations, but the rankings people do an incredible job of pulling together measures from every county in the country for every sub-factor in that model and giving it to us as a chance to think about what we're doing and how to move forward. So that's why we still think it's quite useful exercise to do together. All right, so let's get started. As was just mentioned, there are two kinds of rankings: today's health or health outcomes, and tomorrow's health or health factors, right? So the today's health is always green in the county health rankings. And that looks at two things: length of life and quality of life. And we are about in the middle of the state for our health outcomes. Technically, we rank 8th out of the 14 counties. So let's just look at the two things that make this up. We're basically in the middle of the state in terms of length of life, which this year includes COVID deaths in 2020 as well. So we are reported as having an estimated 6,600 years of life lost in 2020 due to deaths before 75. So any death before 75 is defined as preventable. And each of these losses is, of course, heartbreaking. And as you can see, many other regions had even much higher levels of life lost. So among other things, I think this reflects our numbers. While they're worse than they have been in previous years because of the pandemic, they are not as bad as they could have been, thanks to a lot of the great work done here on this, reducing the spread of COVID and life-saving opioid overdose interventions and other things that folks are doing to reduce death. Our data on the other half, which is quality of life, looks very good. We're about in the middle of the state, right on target with our results on poor fair health, poor mental health, and low birth weight. So that's the today's health rankings. Wanted to just dig in a little. Wait, did I see another one? There we go. Why our neighbors are dying early. We can see here that it is from cancer, heart disease, and accidents. And accidents here are car crashes, overdoses, and unintentional self-harm and other things, other forms. COVID was the third leading cause of death in the US in 2020, although it wasn't in Franklin County. And the rankings create this sort of age-adjusted rate that is the lower of those two charts that you're looking at to see how we compared in 2020 to folks who died early from COVID as compared to our neighboring counties. So moving on to tomorrow's health, which is really the meat of the county health rankings. Our county ranked 7 out of 14 for the combination of the factors that contribute to the outcomes. So this is good news for us because it's a sign that we're poised to do even better in health outcomes as a region in the future, and it reflects well on all of you and your work. This ranking is made up of many more parts because it's all of those colorful subparts on that model. And so we're just going to look at a few of them. So the first big chunk and really the biggest chunk here is social and economic factors. So that's things like education, employment, income, family and social support, and community safety. Even though wages in our region are low and the cost of living is relatively high, and many of our neighbors are barely able to pay their bills each month, we do have a number of strengths that this ranking recognized. So 93% of us have completed high school by the time we're 25. That's really good. Our income inequality ranking is pretty good compared to the rest of the state. This measure is kind of interesting. It looks at the relationship between the 20th percentile to the 80th percentile of income in a county. So in essence, it's how much higher the high incomes are than the lower incomes. And in Franklin County, that's 4.4 times higher. In Massachusetts, it's 5.4. And in the lowest counties in the US, it's 3.7. The other good news we had was around social associations, a perennial favorite here at the CHIP, because it's defined as the number of social associations per 10,000 population. We have always ranked quite high on this compared to the state average of 9.4. And it's a little weird way to measure one of our greatest strengths here in this region, which is our willingness to help each other and our sense of community, which has been so evident during the pandemic. So it's hard to measure, but this sense of community is a social determinant of health, just like education and income. So this is a new measure this year. They looked at childcare cost burden, and they generated this for every county in America. And it looks at how much two parents making median wage for our area would need to pay for childcare, what percent of their income. And you can see that this is a shocking 44% of their income. Unfortunately, only Suffolk County, which is Boston, has a higher percentage of the income having to be spent on childcare. And the main takeaway here is that quality childcare costs too much for low and middle income working parents to afford, and we've got to do something about it. It's important to think about this number in the context of the other things people in our region are paying for. So I wanted to add the housing and transportation index for our region. This is not from the county health rankings. It's a different source that is on the webpage if you want to dig around in there. You can see that families are already paying on average 29% of their income for housing and 25% for transportation. The green chart there is just showing you what the transportation part of our county transportation burden is. And in case you're wondering, the VMT means the average household vehicle miles traveled in a year. We care about this one a lot because when childcare is affordable and accessible, it allows people to work and go to school. And research shows that in addition to that economic security, it makes high quality childcare is really important for young children's health and development and provides lifelong benefits. But children living in low-income households are the least likely to have their family be able to afford high quality childcare. This is the other new measure they included this year that we wanted to draw your attention to, and that's the gender pay gap, which they also calculated for every county. So even though the pay gap has existed for decades after the Equal Pay Act of 1963, it continues to be a real thing. And here in Franklin County, women on average are earning 87 cents for every dollar earned by men. However, as you can see from my note there, only the islands and Boston are doing better. So we are actually more equitable than many other counties in terms of the gender pay gap. But compounding structures of inequality resulted in even larger pay gaps for people, women of color. And here's a graphic from the Massachusetts Treasurer showing what that looks like in Massachusetts. We don't have the granular data for our county, but you can see here what on average the Massachusetts disparities are, and that's pretty horrifying. And women who earn a lower income for the same work are more likely to suffer from mood disorders, from depression, anxiety, and really large pay gaps are actually associated with worse mortality outcomes as well. So it's a very important health measure. Other areas of concern from the social and economic factors include that the rankings looks at residential segregation. People may remember that they introduced this last year. And what it does is it ranges from 0 to 100. 0 is completely integrated, 100 is completely segregated. And the index score can basically be interpreted as the percentage of either Black or white residents who would have to move to a different part of the county in order to produce a distribution that matches the whole county. So the least segregated counties in the country come in around 23. Massachusetts is at 63 and Franklin County is at 67, which is slightly increasing over the last few years. And we actually are among the worst 3 counties in the state for this measure. The other thing that's really concerning in the social and economic results from the rankings is the racial disparities in children in poverty. The overall rate of children in poverty at 12% is obviously unacceptably high because remember that income at 100% of federal poverty level is $21,000 a year for a household of 3. In our area, it's not until income reaches about $300 that you can actually afford to pay your bills regularly. And a little under half, 44% of people in Franklin County have an income below that 300%. And when you dig deeper into who the children are, instead of just collapsing them all as children, you will see that the poverty rates for children include 9% of white children, 23% of Asian children, 19% of Latino children, and 48% of the Black children in our county. And this is really the result of hundreds of years of systemic racism in structures like access to education, home ownership, employment, and it's having a very real impact on a lot of children in our community. So that's the social and economic chunk. Like I said, there's tons more in there, and on the sheets that you can find at the website, you can compare and dig into each of the other issues in social and economic factors. But let's move on to health behaviors. Here, we have some things to work on, including adult smoking, adult obesity, food insecurity, excessive drinking, and lack of access to exercise. The food insecurity data means that 9% of our residents, which is over 6,000 people, are having a hard time affording enough healthy food on a regular basis. I included a picture here of CISA's map of where you can get free, fresh, local produce with your EBT card if you get SNAP benefits, because that's one of the interesting things that's being done to try to address this issue in our region. Excessive drinking is defined as the percent of adults that report binge or excessive drinking in the last 30 days. And we all know that there's been a lot more drinking since the pandemic. And this data is actually just at the very beginning of the pandemic that it was gathered. And as for exercise, to someone in Boston, I think it might seem odd that people with so much wilderness around them are rated as not having a place to exercise. But we all know that a working mom driving home from working at UMass to Charlemont in the winter can't then just throw their kids in the stroller in the dark and walk the dirt roads without streetlights to exercise. So this actually does make sense as a number for us. And in terms of opioid overdoses, this was the year that they got this data, the rate was 32 per 100,000. It's important to note that data was pulled from an earlier year, and we know that this last year was our highest number yet. A tragic 33 people in Franklin County had fatal opioid overdoses, with another 11 lives lost in Athol. Okay, so then we go to clinical care. So we're in the third set of factors, and these includes a bunch of measures of access to care and quality of care. Here, we're particularly concerned about the following issues that were identified. One is the ratio of population to primary care physicians, 1530 residents to one primary care physician is way below the state and national averages, meaning worse. And it's worse than last year. This new family medicine residency program at Bay State Franklin is a great start. I know folks are here from that today. Thank you for coming. And on the screen, you can see the pictures of the 4 physicians who are coming to join our county on July 1st. So this is a great start. The second is the ratio of population to primary care providers that are not doctors. And this is actually better than past years, which is great because we can do a lot with nurse practitioners and physician's assistants. And under this new COVID era law, they actually can now, nurse practitioners can practice without a physician. So this is a good sign of something that may really help us make a difference in terms of access to public health, to health care. And then finally here, the dentist ratio, which is 1,460 people to one dentist. I mean, just think about how the math just does not work for that, for there to be access for everybody to be seen twice a year and have any problems addressed. It's way out of whack with the state and national averages. And although the rankings don't list this, we do know from our friends at the Community Health Center that there's a real crisis in actually finding and training dental hygienists as well. So all those ratios show that we have fewer providers, or rather more patients per provider than other places. The one where we don't, interestingly, is mental health providers. That's 110 people per mental health provider, which is better than benchmark, but it's kind of a crude measure because it doesn't actually mean they take mass health, and it doesn't mean they even take insurance. So we're not really as heartened by that number as we could be. And then the final chunk of the county health rankings is physical environment, which is made up of air and water quality and housing and transit. measures. And here we're in the middle of the pack as a county, and I wanted to draw your attention to two data points. The first is our commuting behavior, and the second is housing costs. So the rankings report that 3/4 of us drive alone to work, guilty, and I even work in a transit center, and 36% of us are driving alone for more than 30 minutes to get to work. Those are two measures that they report every year. And this is included in the county health rankings because it's an indicator both of the need for more public transit and the fact that when you're driving a long time to work and you're not even walking to a bus to get on the bus and take a long bus ride, you're much more sedentary and you're alone, which means you're not making social connections with your carpool mate who could be there for you in times of need. And because we know that social interactions are good for our health. So that's why they include that measure. And the rankings also report that 16% of our households are actually spending 50% or more of their income on housing. So remember the slide from earlier showing our average residents are spending about 29% on housing. And excessive housing costs, which is what this measure is, basically means that households have to cut expenses in other areas, right? In general, households with low incomes that have a severe housing cost burden are spending 37% less on food, 77% less on healthcare, and 60% less on transportation than households with low incomes that are not cost burdened. And people who are severely cost burdened are spending, in general, about $310 a month on food, which is well under the bare minimum that the USDA says you can spend on food for a family of 4. So these photos show some of the great work being done locally to get people onto public transit through the FRTA's access program and into affordable housing, the wonderful new Sanderson Place senior housing in Sunderland. So there's a lot of great work on that, on those fronts as well. So that's the overview of what the rankings say. There's much more to explore in this data, as you can see from those documents. As a region, we're doing so much good work to improve health outcomes, and we have more to do. We need to expand our collaboration among partners who improve health. We need to strengthen our understanding of how do we dismantle systems that have given generations of white residents advantage and replace them with systems that are designed to repair that harm and end the disparities in health outcomes. And we need to support policy change to improve health, including both local policies like by planning boards and boards of health, as well as state legislation. And on that note, we've asked our legislators here today to share with us bills from this session that's wrapping up this summer that they think are going to help us get healthier, as well as one piece of legislation they're really excited about for the new session, which will open in January. So I'm going to stop sharing my screen and thank you very much for hanging in there with all of these data and numbers. And I will turn it over to our legislators. And we can begin. I actually can't see you all, so we can begin. Senator Comerford, are you here? If so, you can start. And let's see, I have to scroll through here. Okay. Not seeing her, so Senator Heintz and John.
Phoebe.
Oh, you are here?
I'm here. I was just muted. I'll go after the senator, but I'm here.
Okay, great.
No, she called on you first. I think you should go first.
All right, you two, don't fight.
My friend. All right, I'll go first. I'm coming in by phone, so I'm going to focus. Actually, I'm going to laser focus on one piece of legislation, Phoebe, which you know very well, and I do think is, for me, one of the most critical pieces of legislation to get right this session. So first, let me say hi, everybody. I'm sorry, I'm coming in by phone. I'm just on the way to an event. And Phoebe, thank you for cracking open this data. You know, we say all the time in the legislature that legislators need stories, we need heart, and then we need these hard numbers because you can't look away from these hard numbers, right? Data is so critical because we can't address what we can't see and what we can't measure. So thank you for leading us through this. I'm going to talk about a bill that's pending this session called the State Action for Local Public Health Excellence. This is a bill that is based out of a bipartisan commission recommendations. Phoebe served on this commission, and it really looked at the way in which Massachusetts was absolutely not doing our job in investing in local public health in the way we need and can do. And the result is really critically urgent public health inequities in communities, because right now in the Commonwealth, our zip code determines the kind of public health protections we have. And public health, as folks know, cuts across all of the indicators that Phoebe was talking about. So public health practitioners and leaders in communities would address everything from nutrition to housing to the unhoused to climate to housing inspections to everything we can think of that Phoebe just ran us through. So this bill is pending in the legislature. It passed the Senate in one vehicle. We've got great House champions, Representative Hannah Kane, Representative Denise Garlick, and we have support from the great delegation of Western Massachusetts. So I'm hopeful that we're going to get it through, but it's not there yet. And with that, we were able to pass two different kinds of funding this session. One is in the ARPA bill, we passed $200 million that will see us into the 5-year mark with capacity building and data infrastructure and training and direct funding for local public health across the Commonwealth, and real incentives, not just incentives in name, but incentives in also financial support to share services and to innovate. And then the Senate and the House have both begun to actually see the state's responsibility, as the bill indicates that we must, but we're doing that in advance of passing this bill, but we need to pass the bill in order to do a bunch of other things. But in advance of passing the bill, we've begun to fund local public health, local and regional public health in meaningful ways. And I'm very hopeful, because I do think the state has to take a responsibility for funding, in part, in partnership with municipalities, local public health. And I do think it has the potential to be a game changer if we can continue funding public health, build the infrastructure we need, and pass this bill that will set standards and measurements so that we really can move the needle on these important indicators. So with that, I'll stop, Phoebe, with my thanks for you.
Thank you. And Meg Ryan, wave, you are you are funded by the Public Health Excellence Funding. So adding value to the county already. And Joe, do you want to call out any particular piece of legislation you think the CHIP should be excited about and pushing for in the next session coming up?
Well, you know, it's hard to know exactly what to be excited for, because we should still be pushing for all of the work that we have before us this session. You know, clearly there's work in the nutrition space around the Healthy Incentives Program, and Rep. Mark and Senator Goby are critical here, as well as Senator Heintz. You know, we have to enshrine that and then fund it consistently. There's a lot of housing work, like, you know, equitable housing legislation that I believe is critical now and going forward. There's a lot in the addiction space and mental health and substance use, and Rep. Whips and many people in the delegation are really strong here. So part of me resists doing that, Phoebe, only because I want us to make gains on all of these. This session, they're all pending. Many of these bills are moving. So advocacy now in this kind of home stretch moment is really important.
Thank you. That's a good reminder. It's not over yet just because it's ending this summer, people. If you haven't yet flexed your citizenship muscles, you can. All right. Wonderful. Thank you. Thank you so much for your tireless support of the public health bill, which I couldn't agree more about how important it is, and now's the time. We'll turn it over to Senator Heintz.
Thanks, Phoebe, and great to see everyone. I don't know if you've seen in some of the news reports, but I'm home with COVID, so I will spare you the visual and just give the audio. But it really is great to hear this. update and really kind of see in very tangible forms the kind of the narrative that we all live with every day. And just following up with Senator Comerford, I mean, I just love watching her work, and with the kind of the public health piece, the chair, and bringing that implication down to our local boards of health is just the latest example of how effectively, I guess, action-oriented she has proven to be. And I'll tell you the number of times where she sends me a text or gives me a call and says, "Hey, Adam, we really need your help so we can move the needle on this," and makes me feel good about the importance of my role. And then she's like, "Oh, and by the way, we got about $10-20 million more for this in ARPA or otherwise." And so I just love it. Anyway, not sure why I'm dwelling on Senator Comerford, but lots of love.
Oh, she's worth dwelling on.
Yeah, there you go. There you go. So I think it's hard to know where to start given all of the connections with all of these things. And I love that the county health rankings deliberately focuses on that. And so, you know, for me, for example, it's hard not to talk about Franklin County and Western Mass without talking about the need for investments in everything from childcare and housing and transportation and just the fundamentals, obviously broadband and on and on. And so maybe know that a lot of our focus in these areas is when we have a big ARPA bill, the question before us as legislators, as a delegation is, okay, well, how is this impacting our region, and how do we either drive more to this region, or how do we adjust the formulas that are being used to determine where it goes? And so maybe I will try to focus on two things. And I don't know, Natalie, do you plan to talk about the Rural School Commission as one? I will go light there if you do, because I think it's very significant for the region and bringing resources and opportunity to the region. So maybe give me a quick up or down on.
No, you're good to go. Thank you for checking.
Okay. So Representative Blais and I'll give a quick version of this, and then I want to talk about a revenue item or two, because you've seen maybe headlines this week that it looks as though the Senate and House will be acting on some form of tax relief, given the current status of our monthly revenues, which were $2 billion in April over benchmark. So I'll talk about that in a second. But I want to say that, you know what, this is awkward. I need to walk outside for 3 seconds to drop something off for someone. You know what? No, I'll finish my report and then do this. So here's the thing. Natalie Blais and I have been co-chairing the Rural Schools Commission, and this is a kind of a continuation of the Student Opportunity Act. And this is precisely an example I wanted to raise, because here we're celebrating rightly the Student Opportunity Act, which is bringing $1.5 billion of new money for K through 12 education after full implementation in year 7. And that is fantastic news, because it deliberately was focusing on low income students and English learners and the like. The bad news is it essentially demonstrated the challenge that we confront as a region, which is when we looked at the impact of most of our districts. I can speak for my district. So basically 2 districts did well. 23 other school districts basically saw the status quo after year 7 because of declining enrollment and other factors. And so it was a pretty clear example of saying, well, hold on, actually rural areas are treated differently and require a different look. And so what we ended up negotiating was that at least we have a commission that would say, well, can we make a rural factor, or a factor of low and declining enrollment, one that is permanent? And so without getting into the details, we now have a report, and we're working to implement those findings. And the result, we hope, to be worked out during the rest of this session, would be tens of millions of dollars in additional funds for schools, largely in Central and Western Mass. And I say that because when I look at the school that I went to, Mohawk Trail Regional High School, we've witnessed a very dramatic decline in enrollment and decline in funding as a result, and a decline in our ability to keep and attract people into our towns. And so the impact for, obviously, one of these fundamental social determinants of health is significant, but also for the economy and beyond. So I just wanted to highlight that as something that we're really in the middle of as we speak, and one that I think is an example of what we're doing in multiple areas. I just wanted to speak briefly on the revenue piece, because it's an interesting moment where, I don't know if you've noticed, been following, but the governor put forward some $700 million in tax relief. Some of them are a non-starter for us, including related to capital gains and reduction in taxation, but others make a heck of a lot of sense. Child tax credits, senior circuit breakers, those types of things. I think, so what we're in the middle of doing now, and as the Senate President said, is we'll probably take it up in earnest after the budget, which is the end of the month for the Senate. And so I honestly would be interested in hearing from all of you. I'm working with my co-chair in revenue to identify what's on our top list. And you can imagine, for example, an expansion of EITC and those types of things that hopefully will put money directly in the pockets of a lot of folks in Franklin County. And so I just wanted to highlight that as a key and timely discussion to be had. We're obviously walking a fine line when you say, sure, we had higher than expected revenue in April, but we always have high revenue in April because of taxation, but it was higher than normal. And what are the factors contributing to that, and not taking money off the table for a sustained amount of time just because it's a temporary increase, et cetera, et cetera. So anyway, I wanted to give that quick update. There's so much to talk about. Many thanks for all this work, and to be continued.
Thank you. And I sure hope you feel better soon. I just want to point out to people that both of the things you talked about are like the perfect example of those things at the bottom of that health model, right? Like, this is a commission being pulled together to do the challenging work of actually changing formulas that will be baked in forever, and make a difference in our region. And same for changes to taxation structures. So that's exciting to hear. And should people contact your office if they have feedback on what kinds of tax relief would be of particular interest?
Absolutely. So we have John Gould here. I'm putting my email in the chat now as well.
Okay.
That'd be great. Yeah.
Thanks. Joe, you came off mute. Did you want to say something?
Just super quickly, I just wanted to say that the work, I really appreciate Adam's work on revenue a ton, but I just want to double down on what Adam and Natalie are doing with the Rural Schools Commission. It's seismic work. And I just wanted to gush a little because Adam was so kind about the public health work, but their work in this Rural Schools Commission is going to change the face of education, hopefully, in the Commonwealth, and be such an unbelievable boon to our region. And it has been hard work that Natalie and Adam have been doing with their great teams and great folks in their midst. But it's just been something to see. It's incredibly inspiring.
Thank you. Thank you very much. And it's so great for us at the local level to hear about what is happening, what is happening at that level. So it's wonderful. So Natalie, would you like to go next?
Yeah, well, while we're sharing the love, it is really great to have such great Senate partners, and I do want to just give a plug for the SAFE legislation and really thank Joe for her leadership on that. And it has been a tremendous pleasure to work with Adam Heintz on the rural schools work. And Adam, I do hope you feel better. Really, I'm sending all of our best to you. So I just want to shout out, I want to give a win. Last summer, and I don't know that we had the opportunity to talk about this, Senator Comerford and I had offered legislation to improve access to dental care in the Commonwealth. And last summer, the administration announced a 65% increase in dental reimbursement rates for community health centers. That fulfilled the goal of the bill. And this was a public health win for us. So I know with COVID, we haven't really had the chance to really get together often and share these wins, but I want to thank everybody here who advocated in support of that piece of legislation and got us to the point of that increase, because it really made a difference, particularly here in rural Western Massachusetts. The other two bills that I'm really supportive of right now that I'm hoping we can move forward, and so many of you have partnered with us on this. I want to say thank you to Alexis, who is here, really been instrumental in an increase to increase regional transit accessibility in the Commonwealth. I think we talked about this the last time we were together. This bill would support our RTAs, providing financial assistance, technical assistance, basically implementing the recommendations of a 2019 report that really called us to support our regional transit authorities in a way that we haven't historically. We know that public transportation is key to everything that you talked about in these findings. And so we want to make sure that we are supporting our RTAs. That bill did move favorably out of committee and is currently pending in Senate Ways and Means. So there is some additional advocacy there that we could use to get that bill out of Senate Ways and Means and to the floor for a vote, so that we can bring that bill forward to completion. The other thing that is gaining a little bit of momentum right now, and I don't know that it's an interesting thing to think about, is accessibility to e-bikes or electric bikes. As we're looking at closing these last mile transportation gaps, we're finding that sometimes in some communities, e-bikes can be a way to do that, while also lowering our transportation emissions, which is one of our highest emissions that we're seeing in the Commonwealth. 40% of our emissions come from the transportation sector. So if we're able to get more people onto e-bikes, I think that out here, it could solve a last mile transportation issue, at least in part of the year when it's not snowing. But it can also get more people out onto the roads to enjoy our scenic byways. It can help to fuel economic development. And also, it can break down a barrier for people who are not able to get onto a regular bicycle for health reasons, for mobility reasons, whatever it happens to be. This could be an interesting way to solve, or at least take a little chunk out of many of the issues that we've talked about today. So I have offered a bill that would incentivize the use of e-bikes, providing a rebate of $750 towards the purchase of an e-bike. E-bikes typically cost $1,000 and above. So at the $750 mark, we're hopeful that we would be able to help people to make that leap and maybe try out an e-bike. I rode one for the first time, and it was pretty amazing. It was a lot of fun, and I think that it could go a long way in helping us to meet some of these goals. In terms of looking ahead, I just wanted to highlight the report that Auditor Bump put out that really looked at the infrastructure challenges that we're facing here in Western Massachusetts. And what we really need is a rural investment plan that looks at each one of the categories that you raised today. It's housing, it's economic development, it's education, it's childcare, it's broadband, it's a whole menu of options that we really have to be focused in on. So I'm hoping to work alongside you and my legislative colleagues to really delve deep into what a rural investment plan would look like and how can we really broadly, comprehensively identify what we need out here to begin to address many of the issues that you've raised today and the things that we need to work on. So with that, I'm going to stop. I'm going to log off of my screen, get onto my phone, because I do have to get to Turner's for an event with Senator Comerford.
Okay. Thank you so much. And
thank you all for being here.
Oh, thank you for all your work. Goodness. And so we will make sure that in the follow-up email you guys get, there is a link to the bill that that Rep. Lay is talking about, in case you want to be helpful in encouraging the Senate to move that regional transit bill along as well. And also, Natalie, I hope you saw before you leave the wonderful thanks from the Community Health Center's COO here about the reimbursement, because goodness knows they're having to spend so much more on PPE and everything. So that's
They were tremendous partners in making that happen. So thank you to them. Oh, you're muted.
Oh, I am muted. It's so true. Rep Whips, are you here? And would you like to share your priorities with us?
Hi, everyone. I am also in the car heading to Turner's Falls to meet up
What's
with
happening in
Senator
Turner's Falls?
Comerford. An event on a veteran suicide, which is very important and falls into, it's hard having the last name Whips because I'm always at the end of the line. So when everybody's asked to mention things, I'm listening to my colleagues saying, all right, I got to check that one off, and they got that one. So what a fabulous team I work with, and wonderful people who have just dug in really deep with regards to the health and wellness of the people of this region. For years prior to COVID, my big thing was telemedicine, and how can we make sure that people get the mental and physical clinicians and specialists and have access to them and not have to go to an office. So telemed is something that has been proven to work because of COVID. So very few great things have come out of COVID, but telemed, love it. So I'm hoping that continues with expanded broadband in our region. Certainly makes it easier for people. We're not in our rural areas driving up the hill to make sure we have a good enough signal to meet with our doctor or counselor. And what I've realized recently is mental health telemed is very much needed, oftentimes isn't covered by Mass Health, and is not covered by insurance if your counselor is out of state. And that's something that doesn't fall under the licensure committee. It actually falls under public health. So we're going to try to work with our colleagues in public health and make sure, because I've had numerous calls from people who have found a great counselor for their LGBTQ youth, but that counselor's in the Carolinas or in California or somewhere else. And how wonderful that we have the ability to reach out. But if you can't afford to pay out of pocket, you're out of luck. So my goal in the future is going to be to make sure that people have access to mental and behavioral health, as well as specialist consultations across this country, because there's some brilliant minds working, and we do need to beef up our capital, our personal capital, with regards to the number of counselors we have and their expertise level. So that's going to be my focus over the next year. And also, one thing when we talk about a community's health, we have to talk about economic health as well. And as a small business owner, I see time and time again that your business is much more successful when your employees are healthy, when they have access to mental health assistance, when they have good medical insurance, when they have access to doctors, and when they have a supportive community. So my work is always going to remain focused on how can we have the most healthy community. And by good health, I mean, it's got to be economy, it's got to be mental health, it's got to be physical health. I mean, we call ourselves the Commonwealth of Massachusetts, but I think we need to focus on the common health of Massachusetts right now, and how we can make sure that people are happy. And I love working with my colleagues, the ones on the line here, as well as my friend Marjorie Decker from Cambridge, who's doing a lot of work to what can we do to bring people out of deep poverty, and how can we offer assistance and support. And the cliff effect is something we're all interested in, where if somebody is receiving services and they get, I had an 80-year-old constituent on food stamps come in, and her Social Security or pension went up $28, and it dumped her off of $118 of food stamps for the month, that $28. Wow. So we need to examine that cliff effect and how it is genuinely affecting people, and how we can build people up and make sure that they're secure in their homes, that they have enough food in their pantry, that their houses are warm. So you can't function well and you can't be a healthy person if you don't have those basic needs. So I'm proud to work with all of my colleagues. I'm sorry Rep Mark isn't on the phone because he too is a champion of
I'm here.
working families.
No, I'm here.
He's
I'm-
here.
Oh,
He's here.
I'm here.
all right. Well, I'm going to turn it over to Representative
But feel
Mark. And
free
I'm
to
gonna-
gush.
I am going to, I know everybody else got gushed on. Paul Mark's amazing. I will turn it over to him because I am racing down Route 2 to get to Turner's Falls.
All right. Thank you so much, Rep. Phillips. Really, really appreciate your comments and very excited to hear about the potential for working with DPH on that particular telemed barrier, which we hear about all the time, given our youth mental health crisis here. So definitely count on some follow-up from us on that. See how we can.
Thank you.
Great. All right. Paul, last but completely not least, wonderful to have you with us. What
I'm
bill
also
would you?
I say I'm also in the car, but I'm going to Hinsdale. I'm not going to Turner's.
Okay.
I'm going to go off video and just in the audio.
Okay, I think that's probably safer. Yes, thank you. Great. So what bills would you like us to think about that have made a difference and that will in the future?
Well, first, yeah, thank you to all my colleagues. They all bring an important perspective, and we all have a little different specialty area. So it's good to hear from each of us what we're working on. And I actually was going to gush about Rep Whips for a second. I don't know if she left the call or not, but I think it's important. And it's not just because she's a world-class chef and baker and cooked a cookie that looked like me for my birthday fundraiser last night. No, it's beyond that. It's actually because I think she's often kind of the forgotten beetle in the group. And the reality is, as I leave the house, she's going to become the senior member of the House for the entire Valley and the senior woman in the House for the entire Valley and almost all of Western Massachusetts. And when we talk about public health is about everything that's been discussed today, but we don't want to forget about racism, and we don't want to forget about
Oh, we can't hear you, Paul. You are breaking up.
And Representative Whips now, a lot of people talked about whether they were Republicans, independents, what. Oh, of course, but can you hear me?
No, you're better now. Yep, go ahead.
Better now? Okay, I was gonna say,
Yeah.
a lot of people after January 6th and whatever, whether they be presidents of the Senate, majority leader of the Senate, or speakers of, or minority leaders in the House, talked about how horrible what happened was, and then now they're talking about that person running for president in the future and supporting them. Representative Whips actually stepped away from the party because of Charlottesville, because she cared that much about rights for every sex couples. That's important, and she doesn't get the credit she deserves for that. She didn't just talk about it, she walked the walk. And now adding on part of Greenfield to her district, I think it's important that people realize you do have a champion for a lot of things that we care about deeply in Franklin. So I just want to get that out there. And for me, communities bigger than the state of Rhode Island, losing the towns that have been in my district, including Greenfield, Bernardston, Leiden, and Northfield, which is very sad. It's been an amazing honor to represent the people of Greenfield for 10 years and Northfield, Leiden, Bernardston for 12. And I will miss people moving forward. With redistricting, the way the House district's going to look are going to be different, with Rep. Blay taking most of West County and half of Greenfield, and then Representative Whips taking the bigger half of Greenfield and most of the eastern part of the county. But I know they will continue to serve everybody well. And then for my little plug is going to be about the environment. So obviously what's important when we're talking about public health, talking about clean air, clean water, making sure that people have a future where we're going to be able to grow food. We're going to be able to have a sustainable world and a sustainable region. And so as vice chair of the Telecom, Utilities and Energy Committee, we've been working on several climate bills that are starting to coalesce into a bigger package right now. We have an offshore wind bill that came out of the House. looking to try to focus on clean energy, get more clean energy and renewable energy produced right here in Massachusetts. The Senate side, they added a lot of good things, and that's going to a conference committee that hopefully people have the chance now to weigh in on and let both the House and Senate members know what do we want to make through into the final version that we think will become law. And then I've been personally working on this idea of green financing for a very long time. I feel good that the House is going to actually put out a green financing bill in the near future. And the idea of that is to try to get support for both jobs in this sector and for financing projects that, again, are going to make a more sustainable climate, which is extremely important for the health of us, our children, and our grandchildren. So great to see you, Phoebe. I look forward to having you in my district again. It's been a long time. And thank you. And just really great to be here with everybody briefly. Thank you.
Thank you so much. What a great way to end. Really appreciate it. And if you, I know you're driving, so if you or anyone else has a link they could share later to the 2 versions of the bill that you're describing, since it sounds like you're suggesting if people would like to let the conference committee know what's important to them.
If you want, I can email you later, and
Sure.
if you want to share, it would be great.
That'd be wonderful. That'd be great, because we'll share that out with the follow-up with the recording and the slides. All right. We didn't miss any legislators, I think, because that's the whole group of them, and how lucky we are to have such a wonderful group of policy setting partners to work on the kinds of stuff that we just spent the first half of this conversation discussing. So I want to let you out exactly as at the time I said I would. I want to thank every one of you for the incredible amount of work that you are doing somewhere on that model. And I can see just about every piece of that model of health here, every possible social determinant of health, from healthcare to housing to transportation to schools. So I'm so grateful to all of you for the work you do to make this such a great place to live. And I look forward to keeping doing that work with you. Follow up with me if you have any questions about the rankings, or you want us to do a training about how to use them or anything like that. And have a wonderful Friday and weekend. Bye.
Thank you, everyone.
Bye. Thank you, Susanna.